Diabetes is it's something that doesn't have to happen, especially type 2 diabetes, and we'll discuss that tonight, both type 1 and type 2, and determine. And most of you will know what we're going to discuss tonight, but the treatment of it and what kind of supplementation we can use, and that's the real nugget here for you to leave from. But diabetes, I've seen it. I've seen it in my practice. I've practiced here in Bountiful, Utah for 23 years and have seen some pretty amazing things. Toes cut off, feet cut off, ankles up to knees, and then finally just die of the diabetes. At one point in my practice, we were doing body wraps with minerals from the Great Salt Lake, where we would soak a ace bandage in fluid in this mineral from the Great Salt Lake, wrap the body, and it would help detoxify. And one of our patients had significant diabetes, and I just remember taking the body wrap off of him after we were done, and the distinct odor that was there made me want to never have any sugar in my body ever again, because he was starting into significant loss of blood to his lower extremity, and we were just trying to detox and pull that out. But it's something that doesn't have to happen. But the problem is we're all sugar addicts. That's what we've been raised on here since we've gone into the Industrial Revolution and all the reforming of normal sugar and complex carbohydrates. Most of us live on fast food, and it's just amazing to me to watch the various restaurants and the fast food restaurants and how busy they are as we drive through in our fast-paced society. But just a quick note on me. This is me. I'm a doctor of chiropractic and a natural internist, and I've practiced 23 years here in Bountiful, and I've really enjoyed coaching patients and other practitioners on how to create wellness centers. But this is it. The metabolic syndrome is poor metabolism, which is from the adrenal glands to the thyroid to the pancreas. It's all a precursor, and I like this. Diabetes just ahead. It's coming your way, and it's just so amazing that the type 2 is so proliferative here in the United States and in Europe, wherever we've become smarter than nature and process things. So before jumping into diabetes, a precursor to diabetes is known as metabolic syndrome or syndrome X, where we're having troubles absorbing the sugars that we eat and actually getting them into the cells. So we have a lot of insulin released, but the insulin is not able to interact with the cell appropriately, and we actually end up having too much sugar in the system. So syndrome X and metabolic syndrome is an up-and-coming discussion. But when we look at metabolic syndrome, there's a cluster of things in this condition. So a condition caused by an uptake of type 2 diabetes, or an uptick of type 2 diabetes, including high blood sugar, excess body fat, abnormal cholesterol levels, and these conditions increase the risk of disease, stroke, and diabetes. So this look of not only is this guy fat, it's going to be fluid, it's going to be water, and bloating from maldigestion. But that's all part of that syndrome X. So more than 47 million Americans have metabolic syndrome. That's amazing. So the American Heart Association recognizes metabolic syndrome as particularly dangerous for people 60 years and older. And that's when it really hits. That's when our metabolism slows down, when we don't have enough energy to really get up and move and do our normal activities anymore. So right here now, excessive fat and sugar consumption and poor lifestyle behaviors may lead to a pathological state called metabolic syndrome. So if you think about it, and I wish I could talk to all of you on the phone tonight and have you raise your hands, how many of you are sugar addicts? How many of you secretly drink Coca-Cola? How many of you can't wait till everybody's asleep so you can go raid the refrigerator? Guess what? Many of us do. And I got to tell you, I'm just myself getting off of Coca-Cola and pop and coming down and coming off of my sugar addiction. And I feel so much better. I'm diminishing my amounts of breads and wheat and, of course, refined sugar, and eating more salads, and I just have more energy, and my feet aren't hurting as much as they were. I was heading towards diabetes, and I'm reversing that. My mom had it. My mom ended up with type 2 towards the end of her life. So I just don't want to do that. I don't want to end up seeing myself do what my friend did as I took his body wrap off. So diabetes and blood sugar. Diabetes is a disease of degeneration and inflammation of the pancreas. So the tail here, this is where the pancreatic ducts are, and I find many times with diabetes that we can ask the body using kinesiology, what's going on? Is there a layer of infection, of which we'll talk here in a minute? But microparasites are very common, that we'll get microparasites here in the tail. And so microsite, with which we'll discuss, is a great one that helps get rid of that inflammation. Why is there inflammation? Because of the overstress and basically the stress on it from eating so much sugar, one, and then two, the layers of infection. But this is a great look of what the pancreas looks like. So not only do you have endocrine function, but you have exocrine function. So endocrine would be the insulin, and exocrine would be the digestive enzymes produced by the pancreas. So it's the only organ that does both endocrine and exocrine. So that's kind of interesting. So basically the degeneration leads to the inflammation. So we have two types of diabetes, type 1 and type 2. So type 1, the more critical condition of diabetes, when the body's immune system destroys the cells that release insulin and eventually leave the body without insulin production. Without insulin, the cells cannot absorb the sugar or glucose, which is needed to produce energy. So many times when I see somebody come in with type 1 and a child, I'll ask them, well, when did this begin? Well, I just was really sick about 5 weeks ago, and right during that same time, my sugars went all haywire. So it's not only microparasite in the tail of the pancreas, but it can be hit by a virus as well. And it can also be, and I read information that's not in the PowerPoint here, that the body on the autoimmune issue with leaky gut syndrome, when children drink milk, the protein in milk is very similar to the pancreatic protein. This was an article I read where they found that could be one of the issues. So as you leak milk, if you will, milk proteins, long chain carbons through the gut, when those are picked up in the system, in the liver, or anywhere in the body, those are picked up by our own body's antibodies. So now you have an antigen, which is abnormal proteins coming through the leaky gut, are affected by the antibodies. We get what's called an antigen-antibody reaction. Now that's then imprinted into the antibodies, so their mandate to go look around the body and find protein that looks just like this milk that's come through. So the idea is that it's looking for milk and sees the pancreatic tissue as very similar in content and will therefore start to attack within the pancreas. Now, of course, there's other issues to it as well. There is a predisposition from DNA and from our parents and so forth. That's also there. What we want to do is try to shut that leaky gut syndrome down and make sure that they're not having too much talk or too much hyperpermeability coming through the gut. Type 2, the body isn't able to use insulin the right way, and leading to insulin resistance. So as the pancreas produces less insulin, the body suffers insulin deficiency. This is basically, you've got to go out and buy it. Type 2 is an overuse of sugar. It's making it so that the body no longer produces as much insulin, and it also, the body becomes just resistant. You just can't get it through, and that's the syndrome X. So on this next slide now, let's talk about the differences here. So symptoms usually start, this is type 1, usually start in childhood or young adulthood. They can be genetic or caused by an infection of the pancreas. Episodes of low blood sugar levels, hypoglycemia, are common and not considered preventable, but may be manageable. Well, it is manageable, and it can be dropped with what I'm going to tell you. We can have our patients come off of completely, or at least diminish the amount of insulin. Now, one of my patients came in, and she is 16 when she got her type 1 diabetes, directly following a viral infection, and we have actually kept her off of insulin, me and other therapists, by managing her diet and working with pancreas and other issues, other things. But that's something that can be done even on type 1. Type 2 definitely can be handled. Type 2 usually may have no symptoms before diagnosis, usually discovered in adulthood. It's increasing numbers of children are being diagnosed today. with type 2 because they're eating themselves into it. And it's, again, caused by overuse of the pancreas. No prior episodes or low blood sugar levels. It can be prevented or delayed by healthy lifestyle, weight, and exercise. So I think this is so important, and you literally have to go out and buy type 2. And that's what we'll discuss here in a minute again. So with type 1 symptoms, sick stomach, weakness, very thirsty, frequent urination, belly aches, deep and faster than normal breathing, unplanned weight loss, nausea and vomiting. So here's the idea of why you actually can get the nausea. The ketones here that are produced create stomach aches. So ketone is a chemical substance created when your body resorts to burning fats. So ketones build up in the blood and in dangerous levels create life-threatening conditions called ketoacidosis. And those ketones are what create that sweet smell on the breath. So this is produced when you start to metabolize fat because of the issue with the pancreas going down. So that's what also then the stomach aches are caused by the nausea and vomiting are caused by those ketones. So that's type 1. Where type 2, unusual thirst and hunger, extreme fatigue and irritability, frequent urination, unusual weight loss, blurred vision, slow to heal cuts and bruises, itchy skin, and gum or bladder infections. So you can see this start to progress in your patients, and as they start to get the belly fat and fluid retention. Again, the fluid retention is usually because they're toxic. So the water in the body is attracting to the toxins in the lymphatics versus being able to be excreted out. So there's also tingling and numbness in the hands and feet, dry mouth, yeast infections. Yeast infections because there's so much glucose. Yeast is fed by glucose. So an abundance of glucose always allows yeast to thrive. So infections can grow in warm, moist folds of the skin, including between the fingers and toes, under the breasts, around the sex organs. So if you think about it, people with type 2, you can smell a definite sweet odor to them, and that's the fermentation being caused by fungus and yeast that's either on the skin or anywhere on their system, on their tongues and so forth. And I really like this picture here. I don't mean to go against Fruit Loops. They used to be one of my most favorite. Average Americans consume between 150 and 170 pounds, holy smoke, of refined sugars in 1 year. So think about a 5-pound bag of sugar. That's amazing. So type 2 diabetes is not something that you catch. You go to the store and you purchase it. In other words, you have to eat your way to type 2. Both types of diabetes are a massive concern. I don't know how many people have it, but it's just immense. So for the individual, either type 2 diabetes poses an increased risk of a variety of serious complications. So when you think about it, insulin is released in excess. What the insulin is pro-inflammatory. So with that pro-inflammatory state, you actually have burning of the peripheral vascular. So that's going to be arterioles and venules in the periphery. So in the hands and feet. That's why the peripheral vascular neuropathy comes. That's why you have the glaucoma in the eyes losing because of the small arterioles within the eye, so you get blindness. I just don't want to go there. That's just not for me. So the insulin-glucagon axis is very important. So the pancreas releases insulin. So the blood glucose level rises after eating. So you once you have a carbohydrate, it comes over here. You get homeostasis. So basically, you eat the simple carbohydrate. It comes around in blood. You get your blood glucose raises. Insulin is released, and it stores sugar in the liver as fat, or it stores as a carbohydrate. Then when you have low blood sugar, then the pancreas signals the liver to release those carbohydrates, and you bring the homeostasis back together again. So you're able to balance and keep the blood sugar level. That's how the insulin-glucagon axis should work. But we hardly ever get into where we're drawing glycogen out of the liver. So glycogen will brace that back up. But we're so used to having ups and downs that are extreme that we always want to go have our next bit of carbohydrate. So insulin is released when blood sugar levels are too high. Insulin stores the sugar as fat in the cells. So when the blood sugar drops too low, insulin is released, which releases carbohydrates stored from the liver to normalize the blood sugar levels. The problem, a large number of the population did not have enough glycogen released, so the body pulls carbohydrates from the liver. As a result, people crave and look for more carbohydrates. So glucagon is released, and that's what pulls the glycogen out of the liver. But we don't get the glucagon released much. We're usually always going back to the crave, looking for more sugar, and we don't ever get to that glycogen and the glucagon. So that's what we'd like to do. If we could start to eat more fruits and vegetables and more complex carbs, then we would be able to handle this more effectively. So some statistics. So diabetes is a leading cause of blindness and kidney failure and has a significant role in heart disease, stroke, and amputations. So heart disease because it's inflammatory. And when the heart's inflamed, when it's acidic, there's where you start to have plaque, and then you have plaque buildup in the arteries that feed the heart, and then you've got heart issues. Same thing with the kidneys. The kidneys are filtering if you've ever studied kidney, how that functions, it's just amazing how the levels of fluid coming through the blood distills out the toxins. Those toxins then are collected and urinated out. But again, if you're toxic and you're acidic and you're inflamed, those kidneys are going to burn up as well. So this is a sugar consumption per pounds per year. You can just see it going up since the 1820s up to 2000. There's a little drop here, but it's constant up since we've been industrialized. So more than 100 million Americans, 1/3 of the population, have been diagnosed as either pre-diabetic or with type 2 diabetes. 1/3. Now it seems like I remember that they were expecting by 2020 that half would be diabetic. That's just not acceptable. More than 29 million Americans, or 9.3, are unable to maintain healthy glucose and insulin levels. So of those 29.1 million, 8 million were undiagnosed. It's like, well, I'll just go get some more sugar, I'll go get more carbohydrate, and they just don't ever talk about it. So the projections for the costs of treatment for diabetes by the year 2050 will be larger than the gross national product. Can you imagine? More than we produce as a nation. That's just amazing. That's how much it's going to cost to treat the degeneration of eating too much sugar. Obesity rates have continued to climb, and childhood obesity rates are around 33%. That's just not fat kids. That's just not a little overweight. That's obesity. So that's just amazing. So a little bit of history. Profound shifts of self-monitoring have taken place. Since the 1970s, patients were given the tools to measure their own blood sugars, either through clicking and getting the blood test real quick out of their finger. Now we've got insulin pumps that we wear that keep the insulin just right there. So this allowing the individuals to care for themselves is a big change in personal responsibility, as the medical industry usually prefers to micromanage health. So a holistic approach focuses on caring for the whole person by empowering the individual to create conditions for optimal health. We don't want to just say to the patient, hey, all you got to do really is go ahead and have that chocolate cake, have as much as you want of everything. All you have to do is just take a bigger hit of your insulin. It's okay. Really? That's managing my diabetes, but it's not doing anything to prevent it. To prevent having, let's take less of your insulin by monitoring and supporting your food, and that's what we'll discuss here in just a little bit. So the solutions, the goal of health practitioners should be to help provide their clients healthier blood sugar profiles. So healthy diabetic blood sugar range to avoid complications and discomfort. So this means between meals, you should have between 90 and 130 milligrams per deciliter. That's your blood sugar. 1 or 2 hours after should be less than 180 milligrams per deciliter. So what this means is normal blood sugar levels, you eat a meal, you come up to the top, so you have high sugar levels, insulin is released, it drops the blood sugar down, and now you start to get hungry, so then you eat again, and it just keeps doing the cycle. But what would be neat is if we could come up, we'd have our normal food, but if we had complex carbohydrates and protein, then it would be a slower it would be a slower high and a slower fall. And right here, our body could then say, hey, wait a minute, we're getting lower. Let's have glucagon released. Glucagon would go to the liver, pull the glycogen stores out of the liver, and raise us back up. And then, so we're not eating down here. When I say, oh my gosh, I'm famished and I'm starting to shake, but actually bring it so that right in through here, our blood sugar is level. And now we eat. So this would prevent the high highs and the low lows. So that would be tremendous. But that would be done by working with the diet. Okay, so the solution, and this is a great picture. She looks very healthy. She's got good representation of vegetables. Vegetables are lower on the glycemic index than fruits, even though fruits are good, but they're lower on the glycemic index, and they have more vitamins or more minerals in them as well. So, standard healthcare advice: exercise daily. I recommend just 20 minutes of cardio. I'm not so much into the weightlifting myself personally. It does increase your lean mass, which has a higher metabolism. I do like that. But I'm more interested in cardiovascular, getting your heart rate up for 20 minutes every day, and causing those arteries and veins to have more elasticity, pushing them and stretching them, getting the blood flow to really move, because most of us are sedentary. So exercise daily. Healthy food. Also increase fiber in the diet, so don't overeat. Don't eat immediately after workout, and eat at fixed hours. So your body's it's usual. It understands when it's going to be feeding, and it's going to get into a good normal pattern. Don't smoke. Don't just avoid it. Just don't smoke. And it's so tough. I understand addiction. Close family members I have addictions. One's recovering 3 years now out of heroin. Several of them have smoked. I am a Cokeaholic. I don't get the headache after if I don't have a Coke, but I am now about 3 weeks out of not having a Coke. So good for me. And I want to make it stick this time. I'm 52. I don't want to go there. I want to see my mom and other patients. So avoid smoking. Avoid not smoking, but avoid addictions. Okay? Get control of your body. Manage cholesterol and check and balance blood pressure. Check your eyes, your feet, kidney tests. So make sure that they're functioning well. Coping skills. Have people do something when they're if they're at higher risk. So people with diabetes are at higher risk for depression. So cope with it. Prepare your food before. I suggest patients cut up their vegetables enough for 2 to 3 days in advance. Cut the vegetables into smaller pieces. Put them into Ziploc bags with a little bit of paper towel so that they don't mildew. You then can easily come home from work, take a bit of your pre-cooked rice, brown rice, warm it up in a saucepan. On another pan, put your oil, get your olive oil or whatever other kind of oil. Throw in your previously cooked fish or chicken. You can chop that up into small chunks. Warm that up on your hot oil. Throw your vegetables in, saute them or stir fry them for 2 or 3 minutes, and pull your rice off that was previously cooked. Out of the saucepan. Put that bed of rice with your nice sauteed vegetables. Bam! You're ready to go in 5 minutes. The problem with coping with diabetes is when you get home, you're tired, you're hungry. You don't want to make a big dinner. You don't want to make a nice salad. But if you can think about pre-cutting it up and do that for 2 or 3 days in advance, yes, you're going to lose a little nutrient, but it's better than coming home and saying, oh, I got to take this chunk of cauliflower and this whole head of cabbage. If you can cut it and have it ready to go, so that say during lunchtime or in the morning before you go to work, throw your vegetables in for your salad. Put your greens, your garden greens your herbal greens into a Tupperware, and have it ready to go. So all you have to do is put in your salad dressing that you've created at your own house. I like a little squeeze of lemon, some orange, some oregano, salt and pepper, garlic, some garlic salt, and just get away from the bought dressings. That will help as well. But the coping skills is getting it ready so that you know what you're going to eat when you get home. You make yourself some menus. So maybe make yourself 10 menus or 20 menus of things that you like to eat. Go to the store once a week, purchase it all, two to three times a week, cut it up, and you'll notice that'll be much easier for you to move. So this is what I recommend to patients, and I really like this diet picture. That's great. 50% vegetables, whole grains are a part of that 50%. But most of the grains lately, they're a problem. There are some better ones, but stay away from the wheat, genetically modified. There's the wheat belly. I think is one of the books that's written by a medical doctor. The wheat belly creates so much inflammation. 50% veggies, 20% fruits. If you can, low glycemic fruits. 20% proteins. So no greater than 10% of animal proteins. Like the fish, chicken. Try to get your Alaskan naturally fed natural fish, not farm fed. And then 10% oils, nuts and seeds, fish oils. Not so much fish oils now that we're starting to have more issue with the mercuries. But krill oil is a good one. But the oils are very important. Oils such as these will help balance blood sugar, lessening need for the oral medications as well. So now let's talk about the formulas. Pancreas is a great one for stabilizing the pancreatic tissue and function. Every one of the organ systems within Inno-Vita is created with the concept of balancing the DNA. So if you don't understand this concept, Dr. Kim, when he created the formulas, took the information from the Genome Project, where they checked thousands of people and the genetic coding, and found that there was a little bit different genetic coding per organ. So they were able to, in the lab, recreate the DNA strand in mass quantity through chelation. Chelation means placing amino acids in certain orders. So adenine, guanine, cytosine, and tyrosine are the 4 amino acids that when they put those in with chelation, they can recreate the genetic strand in mass quantity. So instead of using animal glandulars, instead of using pancreas from cow or pig and dry them and grind them into powder, Inno-Vita uses form code, which is genetically created strands of DNA, the same look as pancreas. They call that form code. Then, once they found that the DNA was different, a little bit different in each of the organs, they watched that particular spin. So in the pancreas, it had a certain spin, let's say 20 hertz. Dr. Kim then would put one herb in at a time to check to see if that spin would speed up or slow down. If it did, he didn't use that herb. He only used the herbs that kept it the exact same spin. So this just isn't a bottle of herbs. It's a bottle of herbs that are programmed or that are in the amounts and types that keep the spin of the DNA for the pancreas the exact same. Then there's the form code in it. That's the amino acids. So now those help direct those herbs to the pancreas and help to restore proper function of the pancreas through creating appropriate function of the DNA within the cells. So now you have an effective, strong cells that create tissue, that create organs. That's for pancreas. The adrenals, same thing. Thyroid, the same thing. Liver, same thing. So any of the organ systems within Inno-Vita are created in this manner. Holy smoke, guys. That's amazing to me. So we don't have to use animal glandulars. We don't have to have the concern over the animal husbandry that we have when we're talking about using parts from cows or pigs to direct those herbs to those organs. Great idea, but now we can use it bioidentical human DNA within this supplement. Okay, off my soapbox, back to our regularly scheduled program. Pancreas supports blood sugar and stabilizes the blood sugar. Adrenex supports the adrenal glands and supports the thyroid, because these two guys right here are the most important within that metabolism. So that metabolism has to be up in order for blood sugar to work well. Liver G, when we build this is going to support the glycogen release and inflammation from the pancreas. Again, when pancreas helps to pull glycogen stores out of the liver, so we quit getting such low hypoglycemic states. Digest helps to break down the excess sugar because it has the amylase that helps to break down the carbohydrates. So Digesta works with protease, lipase, and amylase. Vanadium comp is vanadium and chromium comp. So this is chromium helps to enhance glucose metabolism. Vanadium is a plant source of vanadium, and this helps to increase the sensitivity of the insulin. So that's very important. These two are very important within that sugar metabolism. The Leptera is specifically designed for our blood sugar metabolism patients, for hyper or hypoglycemics. It's a low glycemic protein form good for diabetic conditions. So within Leptera, it comes in berry, vanilla, and chocolate. It's got the amino acids, the minerals, vitamins. It's instantized rice protein, is the protein for it. It has the digestive enzymes and the good bacteria. So this is just not protein powder. Heavens no. This is designed to balance blood sugar. So be sure to add fiber to the diet where possible as well. So in the morning I have 2 scoops of Leptera chocolate, usually chocolate vanilla. I prefer them. And I'll have a handful of almonds to provide fiber. And then at lunch at about 10 o'clock I'll have a handful of my trail mix that I make. Real quickly I'll tell you this one. I go to Costco and I get raw almonds, raw cashews, and raw pecans. I get a container of mixed salted cooked mixed nuts, and then I mix sliced coconut, blueberries, craisins, and whatever else dried fruit that I want. And I mix that together, and that is a phenomenal support for me at about 10 o'clock in the morning and at about 3:30 in the afternoon when I get a little bit, because I eat at 5 o'clock in the morning, 5:30 on the way into work, and by 10 o'clock I'm ready for a little something. So that's a good balance right there. Also very effective, I'll take a scoop of IntegraCell, of which we talked about, and another one that I didn't talk about yet is called Verdance. So I'll put a scoop of Verdance and a scoop of IntegraCell with a little bit of a carbohydrate mineral drink that we have, and I put that into a shaker cup, and it is yummy. I love it. I mean, I look so forward to that drink because it just picks me up, helps me detoxify, gives me the greens, and it's tremendous. So I'll have that as well at mid-morning, mid-afternoon. Okay, let's move on then. That's Leptera. Then we talked about the layers of infection. So each one of these webinars, I always discuss working on the layers of infection. But when I'm looking at a malfunctioning organ, I'm always looking to see is there infection within that organ. So Bacto-X is for bacteria, Meta-X is for metals and chemicals, Microcyte is for microparasite, small enough that you can see it with they're about, well, actually you wouldn't see these. These are microscopic. You need a microscope to see. We treat this with Microcyte for 40 days constant. They don't have larvae, so you just go 40 days. Paramac are for large parasites, which do have larval states, larval hatching. So you treat this with a 10-day on, 5-day rest period for a total of 4 cycles or 2 months. This helps to remove large parasite. You can use these back and forth together if you want, but always check kinesiologically or muscle testing is the only way I know to determine what is needed. That or EDS, electrodermal screening, can help you there as well. Fungex is for fungus. This helps fungus, mold, candida. This helps not actually kill the fungus, but it helps to die off of old age. So with diflucan, for example, that kills the main body of the fungus, but it doesn't get the pseudopods that are down deep in the tissue. Once the threat of the chemical is gone, the diflucan has been discontinued, those pseudopods will come back up and now you've got it again. So Fungex dies of old age. It can't create more new fungus, and it dies. Lastly, Virox is for for viruses, both RNA and DNA viruses. And we're now heading into cold and flu season, so Virox and Bacto-X is what I do together, usually when I find someone with cold and cough and sinus, along with Tox-X to pull the toxins out. So that's the protocol there for infections. And again, this is a rough concept of how to take them. Pancreas, 4 capsules, 1 to 6 capsules of Adrenax, Thyroidin for a day. But you always want to check to make sure that you're doing kinesiology because you don't want to overload them. So pancreas for the pancreas, adrenal glands, thyroid, and liver. And we've discussed why. It's been wonderful to be with you tonight. I hope that's helped you. I hope that's given you some concepts, some ideas, some information to share with your patients, with your family members, and maybe yourself as well, like me. Have to look in the mirror sometimes and say, guess what? Yeah, I am out of control. I do have a busy practice. I do have a busy life. I've been so used to running down real quick and getting a fix. Got to get a Coke to lift me up. And it's done. I'm done. Let's all be done. Let's all help our patients to be done as well. I would suggest making this be a mantra that you discuss with your patients. I notice that when I teach my patients, I am busy. When I don't teach, my practice diminishes. So I would keep my mouth open. I would take these symptoms and make a poster. Make a quick poster. Make an 8.5 by 11 sheet and just say, hey, do you have any of these symptoms? You might be looking at diabetes. A third of the population has diabetes. So, if you have 100 patients, 33 of them need to be talked to about this. But I've noticed over time, and it's interesting, I look at my hands, and I've kind of have a little bit of flaky skin. I've got some eczema on my knees. My toes hurt at the end of the day after standing up for 12 hours. And I've got a little bit of a white coating on my tongue. I like sugar, I like the carbohydrates. So those are things that are slow, and we've got to see it. We can even watch our patients' fingers, and as they talk to us about their issues. And you might even consider giving them occasionally, every 6 months or so, a questionnaire. Just take this questionnaire and tell me, are there any situations that are happening in your life or your body that we need to pay attention to? And sometimes they're busy just like you and me. They haven't paid attention to it. So I think if we can have things in front of them to have questionnaires on, we ask them questions directly and monitor that, I think that's going to make a big difference, and you'll be able to catch this. But that's a great question. Absolutely. So as we discussed there, the adrenal or the pancreas, I think we're working with the pancreas, the adrenex, and the liver, and of course the thyroid in as well for the metabolism. But if we're really looking at that, that's going to make a major difference as we look at the insulin-glucagon axis. And I hope I explained that well enough. But looking at the pancreas and the liver and stabilizing that insulin-glucagon axis is big. Now realizing as you're starting to get them off of their simple carbohydrates and eating more complex, they're going to really, really desire carbs. I remember when I did this a while back and I was getting rid of simples and going to more, I was actually doing a modified elimination diet. I did a 2-day fast with water and minerals and then added one food back in at a time. I remember walking into my laundry room where we had the dog food for the dog, and I could smell the carbohydrates in his food. Dude, I wanted to get down on my hands and knees and go after that carbohydrate. So tell your patients, expect a couple of weeks of change. You're going to want to really desire those carbs. But if we can start to look at, like I mentioned before, how to make those easy salads, easy stir fries, vegetable soup, where you're creating, like, say, a chicken vegetable soup. Get your chicken cubed up and boiled with some. You might use a different bouillon or season your soup first. Get it boiling hard and then throw in your vegetables and shut off the heat. Take it off of the unit. That way it'll sear it, but not enough that it's going to kill all the vitamins. There's wonderful ways to eat that are still with live food. We change that. We get them on more eating mini meals. This will happen, and they can come down. Our type 1s come down all the time. Our type 2s come off of their metformin and the other things that they have that are manipulating. Yes, you can get them down, and it's not necessarily about getting them off of it, but getting them down so they're not using as much insulin, because the fact that I didn't cover as strongly as I should have was that insulin equals inflammation. Inflammation equals cell death. It equals shutting down of small vessels, peripheral vascular disease. So diabetic neuropathy is the shutting down, is the burning from acidity and from high amounts of insulin.